reporter. Alan, what's going on, man? How are you?
Doing good today, Neil. How you doing?
Our podcast segment today is the extreme cost of healthcare premiums. How do you like coding intensity and Medicare Advantage plans impact the overall cost of healthcare for consumers?
There's a lot of current lawsuits and investigations out there, but Medicare Advantage overpayments. Investigators have revealed that Medicare Advantage plans are overpaid due to practices like coding intensity and favorable selection. These strategies involve insurers inflating patient risk to receive higher premiums. Between 2025 and 2034, Neil, it is estimated that these plans will be overpaid by approximately $1.2 trillion, with $220 billion of that burden falling on the beneficiaries through increased premiums. Now, here's something I didn't know about before. It's something called PBMs. They're called pharmacy benefit managers. These people are intermediaries between insurance and pharmaceutical companies and have come under great scrutiny for practice that may contribute to higher drug prices. They often negotiate rebates and discounts with drug manufacturers, but may not pass those savings on to consumers, leading to higher out-of-pocket costs. Basically, what they're doing, they're keeping that in their own pocket. In Connecticut, legislation like HB 7192 aims at bringing transparency and accountability to PBMs, the pharmacy benefit managers.
Who's responsible? What role do pharmacy benefit managers play in drug pricing, and how does this affect insurance premiums?
Well, the companies like United Healthcare have been criticized for prioritizing profits over patient care. It's just like when I tell people, okay, do you have a mutual company for insurance or do you have a stock company for insurance? A stock company owes their allegiance to the stockholders. A mutual company owns its allegiance to the policyholders. And it's just like this. United Healthcare is stock owned, but has been criticized for prioritizing profits over patient care. Private insurers often have higher administrative costs compared to government run programs like Medicare. For example, private insurers consume about 14% of premiums and overhead, whereas Medicare operates with significantly lower administrative costs. And again, the PBMs, the pharmacy benefit managers, as mentioned, play a significant role in drug pricing. Their lack of transparency and potential conflict of interest can lead to much higher costs for the consumers.
How does hospital consolidation influence the cost of health care services and insurance premiums?
Neil, the merging of hospitals and acquisitions, and I didn't think this, when I first read this, I thought it was just the opposite. But the merging of hospitals and acquisition of physician services can reduce competition, leading to higher prices for services. Research indicates that hospital mergers can increase the price of a stay by as much as 54%. And you can look at that up for Center for American Progress.
What can be done? What policy measures can be implemented to enhance transparency and reduce unnecessary healthcare spending?
Now, obviously, enhanced transparency. Implementing a national all paid claims database can provide insights to pricing and utilization, helping to identify and address inefficiencies. And here's the big thing. They need to regulate those PBMs, those pharmacy benefit managers. Legislation, like I just mentioned, Connecticut's HB 7192 seeks to hold PBMs accountable, ensuring that negotiated savings benefits the consumer. Strengthen the antitrust enforcement. Empowering agencies to scrutinize, potentially block anti-competitive mergers can help maintain competition and controls cost. And the last thing I would say, address Medicare Advantage overpayments. Reforming the payment structures prevent overcompensation and can reduce unnecessary spending and lower premiums for beneficiaries.
All right. The best place to go is strategicwealthstrategies.com, or email you at strategicwealth, the number 0 at gmail.com, or call 910-551-1046 and schedule a call with Alan today. Appreciate it, Alan.
You betcha, Neil. Not a problem. But there's so much stuff out there that people don't know, they need to know. It's just like I say in my financial podcast, think outside the box, think for yourself, do your own research, because the stuff that we're told today, as I said before in other podcasts, I don't believe anything on the news. And when I see something, I always research.
All right. That was the Strategic Wealth Strategies podcast, guys. Take care.